So what are these new services, and how will we create them? Well, we'll create them through, obviously, through new techniques like cloud. And in fact, cloud infrastructure is powerful because it allows us, as you all know from the economics of cloud, to actually amortize certain costs and improve the utilization of physical resources. But that's just the physical part of clouds. That's just the physical statistical multiplexing of cloud. And it's what most people are preoccupied with in clouds today. But that just scratches the surface of what's really valuable and really important in cloud. What's really valuable and what's really important is the ability to manage data. And not just manage data, but share data, and therefore get increasing returns from that data. And then not just have that data and not just be wise on data, but to actually be able to convert that data into decisions or actionable recommendations. And if we can do that, we can make transformations around how that data is used to solve important human problems. So I'm going to pick one industry, which I think is very illustrative. It was the most wasteful one on the chart that we saw before, healthcare. Okay? And I want to talk a little bit about how that becomes a lesson or a prototype for us in the transformation of services. So, healthcare is changing, and I'll show you why. But what I want you to look out for here is the destruction of the assumption of a trade-off. Okay, people usually assume, and in fact it's played a central part in the debate in the United States about healthcare transformation, that if you improve or if you make healthcare more efficient, and you lower costs, that you will necessarily decrease the quality of services. And one of the things I'd like to demonstrate to you is that you can actually, we're so far off the Pareto curve or the trade-off curve that in many of these services it's very meaningful, very possible, and in fact very practical to simultaneously decrease costs and improve quality. And in fact the screenings that I talked to you about before, exactly in this case, if you don't use the information in an incorrect way from the screening, you both decrease the cost and you improve the health outcome. Okay, or at least leave it the same. So you don't necessarily have trade-offs, and this will be a major lesson from what we talk about today. Simultaneously provide better outcomes and lower costs. So let's look at what's the background, what's changing in healthcare. Well, you all know the individual is changing. I mean, Kaiser, for example, in California is a great institution. It's beginning to put a lot of its information on mobile devices. Okay, people are becoming connected. People are becoming individually empowered. Huge amount of information on the internet. But it's also changing from a fundamental data creation. Many of us will actually have our genome personally sequenced, or many of us have already had parts of our genome personally sequenced. So we'll be able to get data which has extremely high leverage to actually find the right treatment and not do the wasteful or incorrect treatment. Value. The game is changing in value. People are looking for outcomes. They're looking to pay for outcomes, not looking to pay for operations or services. And finally, collaboration. IT is allowing us to actually have a much better collaboration between the patient and the clinician, as well as different members of the clinical team. So, what can you do with technology? Well, you'll be surprised, not be surprised to learn that with the Watson technology, after we completed the match, we didn't actually put it on a shelf and forget about it. We actually started applying it, and actually have been applying it for some time, to certain hard industry problems. The one which we're doing the most work in fact, is healthcare. And this is real data from using Dr. Watson to help get a correct diagnosis around a set of symptoms, history, family history, symptoms, history, medications, lab results, etc., which has determined that for this particular patient, the predominant comorbidities are urinary tract infection and diabetes. Okay, that's what it points to, all right? So technology is great for doing the following. It's great for actually improving diagnosis. It's great for looking at masses of data at the point of care which nobody could otherwise cope with. And it's great for having a confidence. Okay, we don't want our doctors to tell us things that they're not confident about. We'd like to understand the confidence. So technology can do a lot. And by the way, since particularly for specialists now, it's almost impossible to keep up with the literature. There are hundreds of papers coming out every day on any one disease. There's no way. What the system can also do is mine through all of that data and actually not tell the doctor what to do, but tell them, here are some care considerations. Do you know that it's just been found that this particular treatment that you're about to recommend, through massive amount of information and clinical trials, no longer helps? A little warning before the clinician goes and prescribes that treatment. Okay? So, care considerations, dealing with the overload of data, and providing a confidence level, which I think all of us as patients would like to know. But there's more than technology. So let me bring you to another illustrative point. And this is an example of a diagnostic and management system that we've put in place using a cloud called the Collaborative Care Cloud. And it's actually implemented with a provider group in Southern California at this time. It's being used to treat patients. This trial is around diabetes. And what it does is the following. It takes all of that data and it uses a cohort analysis technique of finding like patients, looking how they've progressed and across many thousands of patients, and looking how, if they're treated in a certain way, they're likely to progress or not progress. So therefore, it can rationalize the particular treatment to prevent progression of diabetes. Okay, well, interestingly, when doing that, the data came out that there are some doctors who are very, very skilled and have almost 100% success rate at preventing progression of diabetes in certain types of patients, and there are some that are not. And some that are not may be actually effective in other classes of the disease. Maybe they'd been able to spend more of their time doing the reading, since nobody can read all the literature, right? And so that then allows the possibility of not just using technology the way I described it on the previous chart, but actually using it to do a fundamental process change, which is, let's put a step in, which is the allocation of the patient to the physician group that can best help them, that happens to have that skill to help their particular condition. Okay, that's a process change. And more than that, for people that have chronic diseases, since that treatment has to be paid for, maybe the treatment and the financial model can change as well. And we can get to a point where we pay for outcomes, which is, the outcome is preventing progression, versus just paying for service. So I want you to think about that. Technology allows automation and improvement in quality in doing what you're already doing cheaper and better. But if you really want to do it very differently and far more successfully, don't just optimize the cow path. Don't just optimize what you're doing today. Transform the process. That's far more powerful than optimizing what you're already doing. So process transformation always trumps a pure technology automation, and there's something that trumps a process transformation. And that something is a change in the business model. So if you can change the business model in healthcare to pay for outcome instead of pay for service, I guarantee you a lot of that waste will automatically go away because of human incentives. So think about it. Technology, but even more important is a process change, and even more important than that is a business model change which creates the right incentives, creates the right behaviors, and prevents people from being incentivized to waste or provide low-quality services. So that's healthcare. Having done this transformation that we've talked about, productivity, improved quality, doing things differently so that we can transform not just processes but create new and better processes and outcomes, what does that now allow us to do? One of the things it allows us to do is actually now recenter and decide what those changes ought to be. And the way of changing what those outcomes should be is actually by doing nothing less than reconnecting with the customer, or, since the services by definition is a provider and a client or a customer, changing the understanding of that client. Okay, that is the only way you get to the higher level functions. So how do you understand that better? If you're creating a service and you're in the service business, how do you better understand the target and the behavior of your client? Well, again, it's an information-based service, and the way you do it is by, first of all, mining the masses of data that we now have at our disposal, including things like news articles and Twitter and YouTube and Facebook and all of those things, right? Mining that to actually find out what people want, what people think. And what you're doing with this is you're creating an understanding of the collective of the target of your services, right? This is a very fundamental principle in service marketing. You have to understand that client. But we're now enabled with information services to actually be able to do that. We can do that on the top left quadrant, but we can also use typically categorical or quantitative data to actually do very deep dives and look for weak signals in, for example, sales figures. If people are buying your product or buying less of your product, maybe that's because or related to what they're saying about you on the web. So there are weaker signals in there, but extremely valuable ones because they're often measured in units of dollars. So very interesting. And on the bottom there, it's not enough to be able to give somebody a hint about what's being said or what's being bought. The whole process of dealing with this collective, we need to be able to interact and negotiate with that information in order to find out what's actually going on. And that's where the drill down or the discovery occurs. So what I've just described to you is understanding the target of your services by understanding the bulk effect or the macro effect. What about the micro effect? What about the individual? And massive changes and improvements can be made by understanding that little individual. Here's an example. If you were to actually understand Amy Byrne and realize that she has certain demographics, she has certain behaviors which are exemplified by what she writes about on Facebook, certain phone calls that she makes, etc. And this is all, of course, compliant with privacy laws, which vary from country to country, but compliant with privacy laws. If you were able to mine this information in an appropriate way, then think about how powerful that could be to a telephone company that wants to offer a promotion to her to make it cheaper and better for her to influence the many people that we know she influences. Similarly, how can we really begin to put the, have you been into these retail stores where they have hundreds of thousands of items of clothing and no one seems to be buying them? How can you have less inventory that people actually want, right? And doesn't have to be seconded or disposed of, right? Massive waste in the retail industry. And finally, how do you actually figure out what to do with Amy's contributions as a potential employee, as the contractual model, as the model of labor changes, and many people move more and more into a model where they take their skills and apply them not just to a single employer, but to many employers. So this is very exciting, and we see huge changes going on in the way services and products as well are marketed, and the way individuals contribute their capability either as a consumer or a contributor into this wonderful ecosystem that we have. So we've been saying all along, this is all about data. But you knew that. You knew it was all about data. In fact, I've spent a good part of my career working in storage and data management and database. And has anything changed? Well, I want you to think back to the story we told before about where the data is coming from. All the human-generated on a keyboard data is, and even point-of-sale data, right, is all tiny in comparison to the data that's now being generated by sensors, right? In fact, that data is so much so that I said before that storage capability and improvement always outruns processing, which always outruns communications. Well, there's one thing that outruns storage. What is it? Sensor technology. It's able to produce so much data that now that we can't even store it. And by the way, a lot of that data even has no right or no use to be stored. So how do you change the model of use of that data from understanding all the data that's out there to be mined through slowly, carefully, to one where all this data is coming at you through sensors and you need to make decisions now? And the reason you need to make decisions now is because you either have to respond to a disaster scenario, or you need to respond to a fast-moving market, or you need to respond to a financial market effect, or you need to respond to an environmental situation, right? So data is changing. The whole world of data is beginning to change from data at rest to data in flight. And this is generally and commonly referred to as streaming technology. And what it requires you to do, which is very interesting, is to actually decide on the fly all that data that's coming at you, what's significant and what's not. And the fact is you can't just do it all based on the data that's there now. You actually have to look at trends. So you actually have to look back at what the data was before. Is the rainfall increasing, right? Are sales increasing or decreasing? So you have to use a little bit of history. But you also need to look what's on the bottom, which is all the learning. Remember in the Watson example, all that learning over running thousands and thousands of games and learning what kinds of domains are actually used and what kinds of human language tricks occur. You need to use all of that accumulated history intelligently against current and near-current data. And that's what streaming data allows you to do. And I'll give you an example of this. This is a beautiful example that we've worked with the Children's Hospital in Toronto on. Neonatal care, the care of prematurely born infants. And it turns out that for prematurely born infants, the single factor which causes them most often not to thrive, and in fact not to live in some cases, is infection. Okay? They obtain infections which their small bodies and immune systems are not able to deal with. So how do you take all the data and trend that data and also compare that with all the histories of what you've observed as happening before in neonatal intensive care situations, and in fact get an early warning even before the signal is clear in the data that an infection might be brewing in a premature infant? Well, you do it using this streaming technology. And this turns out to be ideally suited. It's massive amounts of sensing data, and it's also comparing it against a significant amount of cohort and previous experience data for models that aren't actually perfected yet. Many other uses of this, obviously in public safety and security, obviously in the financial markets, obviously in events like, in situations like radio astronomy, where actually there are situations where I think of the order of petabytes of data can be generated. Petabytes per second, how do you like that, right? So, you know, you obviously need to do a lot of streaming. You need to find the most important events because you can't afford to store all that, right? So, this was already very personal. It's about us and our role as services strategists, technologists, business executives in dealing with these problems. But let me close with some examples which I think illustrate some further points. And I'm going to talk about cities and environments, okay? And to me, these are very interesting because we've recently learned a lot of lessons about the integration and management of services. By the way, what is a city? A city is a place to live, but what determines to a very great extent the quality of life in that city is in fact the services. The education that your kids can get or that you can get yourself, the water, energy, transportation services, the entertainment services that are available in that city, perhaps the crime management services. There are factors. You think about it, a city is a collection of services, and those services are not independent. We found this out in a very interesting way. Actually, you hear a lot about services jobs being placed in low-cost countries, but a little city in Iowa called Dubuque, where we set up a center to do IT services in the United States, of which we're doing many of these, with 1,300 jobs. So we moved into a city of 60,000 people with 1,300 jobs. Doesn't sound like a lot, 1,300 on 60,000, but it did. We actually overloaded, we couldn't find housing. We overloaded the housing system, we overloaded the transportation system, and in fact, we even caused concern about the water and the electricity systems in those cities. So that turned out to be a great opportunity for us to say, okay, what can we do about water? Dubuque is a wonderful little Midwestern town, and the reason we picked it to do further experimentation is because it is small, and you can do things. And what we found out was, yes, we can work on water and electricity and housing and transportation, etc. But what's even more powerful is if we can do them together. So something I didn't know before, but turns out about half the cost of delivering water is in energy. It's the energy of pumping it up and down hills, and it's the energy of running the reclaiming plants, right, that treat the water at the end. So there's a huge relationship between energy and water. This will be my last example. I want to talk about traffic. Before, the guilty parties, the big guilty parties in inefficient, low-quality services are, you all know, health, education, and government. Actually, what about energy? You know, we have an energy crisis. Price of oil is over $100 a barrel. I often spend 20, 30 minutes sitting in traffic with my engine running. huge waste. If we could just cut down on traffic jams, we could reduce energy expenditures around the world, easily by 10 to 20%. Okay? So what do you do? Well, we've been having some fun in traffic. Okay? Top left, cold place, that's Stockholm. Okay? And we were engaged by Stockholm to put in a tolling system or congestion pricing. So what that does is it raises the price for people to drive to keep people out of the city. Okay? By raising the price and by putting automatic tolling, this is a gantry that you see there for tolling, we were able to cut down the traffic in the city, actually significantly decrease the pollution and significantly decrease the traffic congestion, and significantly reduce energy that's being spent on transportation. Sounds good, right? Actually, not so good. Probably there are people now who have to spend twice as long on public transportation getting to work because they couldn't afford the congestion pricing. Because these are the arguments. This is why it hasn't been accepted in Europe. They're on the trade-off curve. We've got to get people off the trade-off curve. Transportation is so inefficient, it's so wasteful, let's do something better. So enter Singapore, okay? So what we're doing in Singapore, having learned, and by the way, Stockholm's a success, okay? It's a success, but we can do it even better. You can get people to break the trade-off. You can get them to both, without charging anybody anything, you can get all of that, not all of that, but some of that traffic advantage. And the way you do it is by optimally using what you have, using the arterial roads in an optimal way. So by redirecting traffic so that hotspots in traffic are eliminated or reduced to the greatest extent possible. And you can do that with boards which say, go this way instead of that way, or you can do it on your mobile phone or through GPS systems or whatever. So think about it. Yes, you can manage the resource and you can move people on the trade-off curve and charge people more, or you can just get more. You can get, it's not something for nothing, but it almost is. You can get more for what you have by optimally using those resources. So that's another effect. A couple of lessons that I'd like you to take away from this. We're all involved in services. Services are very interesting, and there's a huge amount of opportunity to use IT to make them higher productivity and higher quality. Okay? But think about the new services and think about the information base and how we can actually create even more powerful services where we learn together, we collaborate together. Just back to healthcare, if you can take another example. The clinical trial system has been called out by the Institute of Medicine as being completely broken. The clinical trial system is letting us down. And one reason is less than 1% of people ever are on a clinical trial for a disease, right? 99% of the other 99% of people all receive episodic care or practice-based care or regular checkups. What if we could take all that data, noisy as it is, and use that data to make decisions? That would be an information-based service, right? So think about information as the new currency of services, and think about how to improve them. Of course we can make them more productive. In fact, we're obligated. If we don't make them more productive, we are letting the economy of each of our countries and the world down. Also make them higher quality. I cannot stand some of the low-quality services that I have to deal with, right? And I'm afraid it's just about all of them have very questionable quality. Let's improve the quality, and that requires different techniques. We can learn a lot from manufacturing quality, but even though we were manufacturing for 300 years and we only had the revolution in manufacturing quality in the last 50 years, we've been predominantly services business in many countries now for 50 years, but we haven't had the quality revolution yet. So there it is for you to do that, create the quality revolution in services. And finally, not just cheaper and better, but different. How do you do it differently? How do you not just fix what's there, but how do you change the process to be fundamentally different and better? And how do you change the business model, right? You can maximize outcomes and lower costs simultaneously. There's a lot. I've given you some examples. It's very, very doable, particularly in wasteful services industries. And it's a huge opportunity for every one of us to do that. And it requires us to work together. The silo effect is very, very common, very dominant. It requires different organizations of governments to work together. It requires competing companies to work together through standards, through organizations like SRII. We need to get together. We need to interchange standards, benchmarks. We need to get together and present professional papers where we show our best practices, and so we can compete at a higher level of competing on actually doing the best technology, the best processes, the best business models. And I think if we do that, and if we take that as our approach in SRII, we're going to be highly successful. So I thank you all, and I wish you a great conference. And you have an incredibly important job to do. And from what I've seen of the papers, you're doing it. So thank you.